Welcome to Conversations About Grief. Here's our hosts, Steve Davis and the Reverend Ed Arneson.
Hi, welcome to Conversations About Grief. I'm Steve Davis, and this is retired Reverend Ed Arneson. And Ed has quite a career as far as helping people cope with grief. And Ed, tell us a little bit about what you've.
Thank you, Steve. I spent 19 years working in end of life care as a hospice chaplain, a hospice janitor, eventually a hospice CEO. I had experience in end of life care, serving on the board of a very early hospice in Northeast Texas. And before that, I worked in mental health and what we used to call mental retardation.
Okay, very good. Thank you. Glad to have you here today. And I am definitely a neophyte when it comes to grief. I think that would be putting it very generously. I've learned so much.
But you're not a neophyte in knowing how to do all of this, which is more than I know. So that's great.
Yeah, thank you. Thank you. So one thing that's on everybody's mind is the pandemic, COVID-19. It's really hit everything hard. And just how has the COVID-19 pandemic been different for the world as opposed to other major catastrophic events in recent history?
That's an interesting question. And I spent some time thinking about that. And I've tried to compare it to other events in the history of our country. I suppose if you go back to Pearl Harbor, that was such a devastating experience. And no one had any idea at all how that was going to play out. No one ever anticipated that after that day, as Roosevelt said, a day that would live in infamy, after that day, that the amount of sacrifice, the amount of investment in trying to keep our country going, and even in the process of being able to gear up a machine to defend ourselves. And so what I think is that what happened at Pearl Harbor is the primary grief kind of reaction was anger. And if you go further along in history, and those of us I was in college when President Kennedy was killed. And that was truly an enormously emotional experience for all of us. I can tell you almost minute by minute what I was doing when I heard the news, and then over the next week or so, the funeral and all of that kind of national grief. And what I think when I remember that is that it was a real time of grief, and the major thrust of that grief lasted for a week or so. Then people kind of separated and did their own individual grieving of that kind of thing. Mm-hmm. Then the next big event that I think, there are many other events, but there are two others that occurred to me. 9/11, of course, was a great shock. Yes. And it kind of stunned us. And I think it made us think that somehow or the other we were more vulnerable than we thought we were. Yes. And grief does that to us always. Mm-hmm. We think we're bulletproof. Right. And then since the other thing that really occurs to me is Katrina. Mm-hmm. Well, you take all of those and they all have kind of distinctive qualities as a corporate kind of grieving. When you think about the pandemic, it becomes very difficult to put any kind of simple or singular focus on it. And what I think has happened about the pandemic is it has been difficult to focus our grief and be able to grieve because there was so much to grieve about. Mm-hmm. There was, and this may represent how selfish we are as human beings, but we were grieving about all of the restrictions that we had to experience. Right. That we couldn't do this and that we couldn't do that. And the complaining and the whole emotional, psychological, political environment kind of confused the whole thing. what I've puzzled about is why has not the number of deaths had a greater impact on us corporately, nationally, than it seems to have had.
Yes.
And I think that it has to be that it's not an event.
Hmm.
It's not like it happened. The Japanese bombed Pearl Harbor.
Hmm.
The towers were taken down in New York. Katrina struck.
Hmm.
This has gone on and on and on and on. And it's like, I'm trying to grieve today because grandma died of COVID. But by the time I get ready to, and we've seen this over and over again where a family has multiple losses.
Right.
So grief is always pervasive. It always touches so much of our being.
Hmm.
And so I think the pandemic has threatened the fabric of our ability. I think grief is primarily a challenge to a person's emotional resource balance, is a challenge to their resource balance at the moment. In other words, if in their emotional, spiritual, intellectual, social tanks, the resources are significantly high, they're
Mhm.
able to deal with it to some degree, but it's always a challenge. But when our resources are low, and I think that's what the pandemic has done, people don't have the patience, people don't have the ability to, I can't stand one more thing. So I think
Right.
that's what
Right.
has created the sense of such a weird and pervasive and ongoing grief. The grief is not over,
Yes.
and
Yes.
and
Definitely.
right now there are more cases again, so it's a
Mhm.
difficult time.
Yeah, we're seeing another spike. We're shooting this in mid-April of 2021, and we've just seen a recent spike. So back on the back about the pandemic, we live in a short news cycle. It used to be a 24-hour news cycle. Now they're saying it's closer to a 12-hour news
What does that
cycle.
mean?
Things get forgotten about within 12
Okay,
hours.
okay,
You-
okay.
If uh, if for instance, let's say a congressman gets caught doing something,
You mean doing
people
something
will
wrong and they're not going
doing
to get
something
caught doing
wrong.
anything? Yeah.
Yeah. It's going to be forgotten about in 12 hours unless
I
it
got you.
keeps being
I
brought up.
got you. Okay.
So we're in a short news cycle. We all have busy lives. Two things come to mind. Are we just being hit with so much so fast we can't process it? We've got over 500,000 deaths in just over a year. Or is it a suppression of grief? And that's my own definition there. Let me explain what I mean by that. December 2005, I lost my father.
Right.
He passed away. He was 84 and a half, just about. He had heart disease. He had been in poor health for about 5 or 6 years. I knew it was coming. There was still some grief. I didn't handle it so much as I just went back to work. He died on the 18th of December. We buried him on the 23rd. I went and I owned a business at the time. I just went right back as soon as he was buried. I went right back to work, focused fully on work. I would say for probably the next 5 years, I didn't enjoy Christmas at all. I did did everything for my kids and watched them enjoy it, but it was probably about sixth Christmas after that before I really enjoyed it. But what I noticed, a friend that I went to school with that I'd known since the second grade,
Mm-hmm.
I had seen him in 2010. We talked. His dad had been battling cancer for years. Sometimes he would come through, would go into remission. Other times it would come back. And he said eventually he's going to lose this battle. So in 2000, I think it was either 2012 or 2013, his father passed away. And I saw a posting on Facebook. He didn't contact me direct. I just saw the posting on Facebook. And it was as though my father had died again. It was like it was that fresh. That's what I mean by suppression of grief, where we I didn't deal with it. I just focused on work, focused on taking care of family, focused on that stuff. And then I get blindsided by something that 7 years later, by someone's death 7 years later, that, and it feels like I haven't dealt with this. So are we, because there's so much death, are we suppressing our grief, or is it just we're so busy we don't have time to even think about it?
Well, one of the elements of grief always is denial.
Mm-hmm.
And one of the things about denial is it works for a
Mhm.
while.
Yes.
One of the things that people have a tendency to believe is, oh, I know he's dying, so I'm prepared. Well, no, you're not.
No.
West Virginia, many, many years ago, had a young man in his 20s. And this young man had cancer. He was in the hospital in Wheeling, West Virginia.
Mhm.
And I'd been back and forth to see him from the little town I lived in and knew his family. And I went to see him on a given day. And this is before cell phones and all of that. And so I went to see him on a given day, and I left the hospital and I thought, and I may even breathed a prayer, dear Lord, this needs to be over for this poor boy.
Mm-hmm.
I just was so confident that I would not even get home before he died. I was right.
Mm.
So a couple hours, I'm at the house when his mother and father come home.
Mm.
The first thing she said to me is, I can't believe it. I am so surprised. And I thought, darling, your defenses are working really well.
Yeah.
So we always have this a tendency to try to, I've always said, I used to have arguments with one of my chaplains all the time. I don't think people want to grieve. It's painful and hard work, and we try to avoid it. Well, he didn't agree with me. But what I think is, in a corporate sense, people always, there were people at the edges, I'm sure, of Pearl Harbor who, whatever. There were people who did not like President Kennedy, but they were affected. Katrina, it was hard to ignore. And 9/11, I remember a lady who came to visit us from New York who was in her apartment. Her husband was on his way to the Royal Towers, and she saw the plane, number one, hit out her window, and then stood there just kind of in a daze and saw the second plane hit.
Mm.
And she was devastated. He hadn't gotten there yet. He was fine.
Mm-hmm.
So we do try to push it aside and not to deal with it.
Right.
When it's on the national scale, I think what that does is it kind of creates a residue of dis-ease that,
Mm-hmm.
and I think that's been apparent in so much. People, have you ever, I have, in general conversations, no one ever raises the issue about 560,000 people have died.
Mm-hmm.
The networks, they very often try to memorialize some of those people individually.
Mm-hmm.
So yeah, we try to hold it down. I think we've tried to suppress it, to using denial, whatever we can.
Right.
And there's a lot of that going on, the whole idea that, well, the pandemic is just all nonsense. It's nonsense if you're not one of the people whose father, mother,
Mm-hmm.
sister all died.
Right. 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 Yes. Yes. What would you say is the biggest thing we as a country in the United States, we don't understand about dealing with grief in light of the pandemic and COVID-19? What are we getting wrong about grief? What do we need to stop and do?
Well, I've wondered a lot about how do we deal with grief in a corporate sense, in a national sense. And I think what we do, you think about Pearl Harbor,
Mm-hmm.
the memorial in Hawaii for many, many years, and still now, years at this celebration or the remembering of December the 7th, 1941, there are always kind of ways of remembering and bringing that back up. And I think part of it is that we use public events. When the new administration came in and they had a memorial service for the people, that was a good lick. That was a good move.
Right.
I think grief is always, what I've always said, Steve, and I think I'm right, is when it comes to grief, you can pay your money and take your choice. You can grieve now or you can grieve later.
Right.
But grieve you will.
Yes.
And I think that we need to grieve. I think we need to, I don't know that churches have fully recognized a role that they could play, that in a regular way we talk about this loss and about this grief. The fact that we don't sense, I think, the camaraderie, the relationship. I'm sure you've lived in small towns, and I have, and when a big terrible event happens, proms have always been a time of the year. Some high school kid in a small town will get killed, or two of them or three of them in a car wreck, and the whole community just goes.
Yes.
And there's none of that happen. I was raised in a little small town in North Florida, and there was an old man there that everybody knew. He both had a great stock of sins, but beyond that, in my whole lifetime now, I never knew anyone who could at will quote and cite scripture like that old man could. I mean, you could just say, well, what does the Bible say? And he would quote it and cite and give the citation.
Wow.
I was a kid, and I lived in town in what we called Overtown. You went across the river, and so that's where you always went because my town was so small. I came home one night, and all of the lights were on in that little community, and this dear old man had died, and the whole community was together in that process. We're too big to do that now. I mean, we're not. So I think it's having someone speak to it regularly. I think it is structuring organized ways of dealing with that. I don't know how you would do a memorial or a monument or some such thing to the folks who've died, but some form of that I think would be helpful.
That sounds like it would be. Another thing, and I've heard some people discussing online and some forums and things, is grieving over a lost loved one or friend who has passed away due to COVID-19. Is that different from grieving over the loss if, let's say, that same person had passed away from cancer or even a car accident? Is it different, or is...
My first response to that was going to be no, but I'm wrong. Because I knew a psychiatrist from Ireland, and he used to say dying is not the big thing. The big thing is dying alone. And what I know is that so many of these people have died alone in a hospital room, maybe with a doctor, a nurse, or someone, and maybe not even that at times because of the intense activity that was going on around them. And so that conditions their own experience. A bigger process is the families, as much as it, you go back in time, and 75 years ago, people would have just gone through the ceiling if someone said, we've got to decide whether to turn off the ventilator. That happens hundreds of times a day now. And people understand it, and they take it as a way of saying that we're not We're not shortening his life, we're shortening his or her suffering. And
Yes.
so we're
Yes.
comfortable with that and we know what we're doing. What I think is that grieving in this kind of separated environment, and I was not there. I was thinking about this. I was called to a home, a dear sweet lady, and I'd known her for a long time and known her husband. And she had some concern about the delivery of service. It wasn't anything very big, but
Mm-hmm.
she's a very serious person. And so I got there and she said, well, come back here to talk to me. Well, we walked through the room where the patient was. And I thought, well, dear old Mr. So-and-so doesn't have a whole lot of time left. So we went in another room and sat down and we probably talked 10 minutes. And the daughter came in and said, Mama, come here. And Mama got up. Mama first said, well, wait a minute, let us finish. She said, Mama, come on. And he had died while we were talking.
Mm.
She was furious.
Oh, no.
She was furious, not at me,
Mm-hmm.
probably not even at herself, but maybe at him. You
Mm-hmm.
couldn't wait till I could get back. Well, that's a humorous way of thinking about it. But the point is, people have that desire as much as they dread it to be able to be with their loved one. And you've heard this during the pandemic over and over and over and over again. I couldn't even be there with him. I couldn't touch him. I couldn't see him, or I couldn't see her. So I think it is different. I think it has exacerbated some of the pain that is so much part of it.
Yes, yes. And then another thing, and I've noticed this during personal, when I've tried to do research about grief at different points. If you Google the stages of grief, you're going to get about 2 million different answers from Google about how many stages there are. There's all these, and you've told me there's a set number of stages. Has the pandemic changed the number of stages? Has it added numbers to the stages? Has it taken away some? Has it sped it up? Has it slowed it down? What do we need to know?
No, I think the answer is no.
Okay.
I think the thing is that when we talk about stages, there are some confusions. Number one, people have always, Elizabeth Kubler-Ross, the psychiatrist who dealt with dying patients,
Mm-hmm.
she famously created hers, denial, anger, bargaining, depression, and acceptance. And people have carried that away. Those are stages of grief. Well, really, that's not what she intended at all. They're the stages the dying patient goes through.
Right, right.
And so there are different kinds of grief: anticipatory grief, grieving about what's going to happen; a survivor's grief, the grief of the patient. There was a famous video back in the day about the dying patient that said, I really am going to miss me. Really hard concept for you to get to.
Mm-hmm.
But what I think is every person who wrote about grief, starting with Granger Westberg way back in the 60s, a little simple book, Good Grief. That book, incidentally, after 60 something years, is still in print. Remarkably, it's still in print. And so everyone who's written about grief for many, many years tried to break it down into some kind of steps or stages. Dr. Warden calls it task. And everyone finally gave up on the stages business, because what it means is human beings, by definition,
Mm-hmm.
if you put down step 1, 2, 3, 4, their anticipation is I'll go 1, 2, 3, 4 in grief. That's not the way it is.
Mm-hmm.
And so I don't know that in the family, let's say the family who has lost multiple family members to COVID, their grief is probably the same as it would be, other than proximity always has to do with the degree to which grief is intense. If you lose grandma, your father, that grief is real.
Mm-hmm.
And it takes a long time. Grief is, we don't get better. Time does not heal anything.
Okay.
Grief is the hardest work we do. And that work is that we visit the pieces of the process. And in that process, we come to a new realization. Uh, I've been thinking about this lady for quite a while.
Mhm.
Uh, her mother committed suicide,
Mm.
and she did it in such a way that she knew this daughter would find it.
Mm.
And she did it not out of any anger, but because she knew this daughter was the most solid family member who would be
Mm.
able to deal with it.
Right, right.
And this dear lady struggled and struggled, and people often dream when they are in grief. And she dreamed about Mama over and over and over again. But Mama wouldn't talk to her in the dream. She wouldn't answer her.
Mhm.
And so we came to one of the things you do sometimes. I said, write Mama a letter. And I will never, ever, ever forget, nor will I ever stop being grateful that she taught me so much. She brought the letter and she had a different look on her face. She was more confident. And I said, well, did you get it done? Yes. Are you going to read it to me? Yes. And the salutation was, to the murderer of my mother.
Mm.
Well,
Wow.
exactly.
I did not see that one coming.
So intensely personal and powerful.
Yes.
I think grief is one of those things that touches every piece of your being.
Yes.
It, uh, the world is full of advice. You need to get over it. You need to do this. And there are all kinds of things that people do. Someone loses a loved one. Other people quit talking about that loved one. And the person lost, the person who lost their loved one, what they want to do is talk about them. They want to deal with it. They want to have it in their minds. And so I don't I don't think the dynamic of grief. There's a thing that's particularly interesting. People people believe somehow or the other that their grief is totally unique and no one ever had any like it before.
Yes. Yes. Yes.
And that is based on the fact that they are saying no one ever experienced the relationship you had with your father.
Right. Right.
Okay.
Yes.
But it isn't that there's not commonality. The physician may say, I've seen this before about 500 times. And every time a person has this, you all have A, B, C, D. Well, that doesn't mean that we are denying it, but being able to talk about it is to look at what happens. Uh, Emotionally, in the beginning, what I think is that when the person is gone, and proximity is everything, age is not the issue, proximity is. If grandma died and you hadn't seen grandma in 25 years and were not real close to her, you still miss grandma, but it's not the same as if grandma lived in your house for 25 years.
Right. Right. Yes. Yes.
And so I think the dynamics of grief that have all kinds of markers and moments, we all to some degree are going to have some kind of guilt.
Mhm.
To some degree or the other, we're all going to wind up feeling poor. We're gonna have physical symptoms.
Yes. Yes.
I remember this dear old lady, never had flu in her life, and always bragged, I never took a flu shot. She and her husband have been together for 60 years. He died, and she had the flu like 20 times successively. Just one time after, so she thought she did, and the doctors finally decided to diagnose she did, and maybe that way they could cure it, and they did actually. So, there are moments when you get confused. People have told me many times, I think I'm going to lose my mind. And I've repeatedly told them, no, you're not. They feel like it. So grief is a very complex and something that takes a lot of conversation and a lot of talking about. How do people get better? You get better by grieving. You get better by us understanding the dynamics of the process. And if stages or steps or tasks help you, fine. Use them. Use that as a process. And so our country right now has experienced an enormously complex and enormously challenging period of grief. And I think we're getting close to the place where maybe we can deal with it more effectively. And perhaps those of us who trust that somehow or the other our faith sustains us in this, that we will get past this pandemic, and that the grief will teach us, if we will listen, how to manage better in this world.
Very good. Very good. Thank you so much for your answers. We'll be back again on more conversations about grief.
Say what you need to say. 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 Say what you need to say.
Thank you for listening today. Please like this video and subscribe to our channel. If you have any questions about grief, please email us at conversationsaboutgrief@gmail.com.